Hey there.
Hello, everybody.
Hi, this is Brian and Christina from Your HealthySteps, and we're the creators of the Ultimate Foam Roller Blueprint. And we teach foam rolling and self-care skills so you could be active and pain-free. So we're giving you 15 years of experience as neuromuscular massage therapists, and this is really the first step for you for self-care. It's really a basic understanding of your muscles, their locations, what they do, and common pain referrals. Okay, so if you are working on your posture, you need to know how to do some self-care on this muscle over here, because you can't get to it with a foam roller. It's really tiny and tucked up on in there. And if it gets tight, it can create these referral pain patterns down the arm, the hand, and even in the upper chest. So the way to find this muscle, called the subclavius, is if you find this notch right here at the base of your throat and just drop your finger over underneath your clavicle or your collarbone, push in there. It might be a little tender. If it is, that's your subclavius. So this guy travels, it runs parallel to your collarbone, and it attaches to the collarbone. So it's from the first rib all the way to the collarbone. That's where it is, and that's how you can find it. So feel free, press on there and see if your subclavius is a little tender. Okay.
You bet it is. Well, most of us. Mine is, definitely.
Okay, so tell us about subclavius.
So problems with this muscle. So we know that it's in the front, and it's connected to the clavicle and this rib, so it's going to try to pull that clavicle rounded. It's actually there to sort of stabilize it and to kind of keep it down. But I think when it's tight and we're tight, it tends to help us stay in this rounded shoulder posture, which is not good at all. So we don't want to get into that posture because, one, it makes posture, which good posture is critically important, hard to maintain. And if it's tight, it has those scary referral pains, which is pain in the chest and down the arm. We're going to talk about that actually right after we talk about this sort of, the problems that this muscle causes. So again, wacky pain, scary pain, and it really messes with your attempt to be in good posture. So trigger points or pain. So trigger points are hyper irritated points in a muscle because it's been so tight, and it becomes so angry, so irritated, it actually creates pain patterns that fire off into different areas of the body. It's really the muscle's attempt to get rid of the pain and send it somewhere else. So all muscles have these, and this one does too. This one actually has some astoundingly amazing pain patterns. It has one trigger point. So in this muscle, there's one area that tends to, when the muscle is tight, it focuses on there and gets tight, and that is roughly right here. So more toward the inside of this muscle, toward the sternum, toward the center. But where does this pain go to? Well, you can have pain above the clavicle. So this blue area is the clavicle. So you can get pain all the way up here. I don't know if they can see that or not. Okay. On the clavicle itself, and right along the whole area where this muscle resides. So we're really talking that area there, the front outer portion of your shoulder, so right here, the deltoid right there, the bicep muscle, the whole entire bicep muscle. So we're talking all the way down here, and we're going to rotate him a little bit because this is a lot for one little muscle. We can get pain. So we got this whole bicep muscle angry. We got this section right here of your forearm. Actually, it comes down a little bit lower, about right in here. You can actually get pain in the whole palm, the big padding of the thumb itself, and then these two fingers right here. So that's a lot of area for pain. The thumb, the inside of the whole palm, and these two fingers, the front of these two fingers, the forearm, bicep, and this whole area, and we're not even done yet. So we're going to drop this arm down, and we're going to bring this arm up. We can also get pain right along this area. So basically a little bit down into the forearm and your elbow, just this area right there. Can we see that? Yep. And we can get pain in the back of your hand. So here, let's see, I want to make sure I get this right. These two fingers
And so this,
all the thumb.
these pain patterns would really be on the other arm.
Right, right.
Wrist.
Well, this can be on both sides.
Right.
But you're right. I mean, the pain would be either far enough down in here. So sometimes you can get just pain here and here, or in the whole area. So again, pain patterns, they just show up in random spots, or they will elicit pain all the way down to the full length of it.
Yeah.
But because this muscle is on both sides of your body, this can occur on the left and the right. And it's usually the left that kind of freaks people out, because you get this pain all the way down the left arm, and you think, and maybe you got some pain in the chest, and you think, you know, I need to get my heart checked out. And you're exactly right. Have that checked out first, get a good clean bill of health. But we've had clients that say, I'm healthy. What's going on here? And we get working in there, and they're like, ooh, wow, there it is. That's the pain.
Yeah.
And that's the trigger point. So that is one small little muscle creating all of this pain. Pretty amazing.
Right.
Pretty amazing.
Okay. Excellent.
And I'm going to go ahead and say the name, because I didn't do it very well last time. Subclavius. I got really tongue-tied on that bit.
Okay.
Okay. So what can we do about it? So we're big fans of self-care, and part of that is going to be foam rolling. Well, this is a very difficult muscle to foam roll, but if you're foam rolling the pectoralis major, or the chest muscle, you will be helping this tremendously. And along with the stretches of pectoralis major, which is going to either a corner of a room or the frame of a door, and getting your arms up there, and there's 3 positions. One's up high, you lean in, you stretch out that pectoralis of the chest, then you come down into about center, and you stretch it out again, and then you bring your arms down just a little bit lower, and you stretch it again. So it's basically having your hands in those 3 different places, and just gently leaning your body into it and stretching this out, especially after you foam roll. It's really important to foam roll first, break up the garbage, then stretch. And that's going to help this muscle. So that works, but we also want to be able to do some manual therapy, because that is breaking up the scar tissue and adhesions and getting rid of those trigger points. So stretching doesn't quite do that very well. So what we want to do is teach you how to do that. So again, how Christina was helping you find that area. Now, once you find it, and you generally know you're there because you're right below the clavicle or the collarbone, and it's tender, take your hand, bring it in towards your body like this. Let me see if I can get in the camera here.
Yep. In
towards your body, and then wrap your arm sort of around your chest. And this is going to shorten the chest muscle and this
Subclavius.
Subclavius. Oh my goodness. There are just some words that I cannot do well.
Yes.
But when that's released, then it's not going to be as taut, and you're going to be able to get in here. And so basically you can start with just circle movements with your fingers, and you just follow it all along the clavicle, right below the clavicle. And then once you have those circles, and you've done it maybe 3 times, 4 times back and forth, then take the same fingers and just kind of pull down.
Right. And don't be surprised when you're doing this, if you have some funky feelings in your arm or your hand that match the referral patterns that Brian just showed you, because that shows you just found a tight area and it is referring down here. And it's good that you found it before it became a constant pain that showed up right before you touched that muscle.
And that's not uncommon for us to work on somebody and they've never felt this pain before, and we start working on them and they're like, I got pain firing off down my arm, into my hands. What's up with that? And so what Kristen is saying is that's a tender point, and it has not yet turned into a trigger point. And so once it's tender and we work it, then it's like, oh, and it will stand up that pain. And that's a good thing, because we want to get rid of it before it moves into a trigger point.
Right. So the pain should decrease.
It should decrease. Yep.
Yep. Yep.
And that's.
And so if this is, if you're having a difficult time getting that pain away and it just continues, then go see a massage therapist, go see a PT, and have somebody work on you who is used to working on muscles. Don't feel bad to do that. Yeah,
and sometimes you just, it's hard to get deeper when it's really tender and painful, and people are like, I don't know if I'm doing anything right, or maybe, then just go see a therapist, because they're trained to go in there and work it out of there and get results.
Got it. Okay. Anything else?
That's it.
Okay, well, hey, I'm going to put a link below for you. We teach free self-care classes where you can learn how to reduce muscle pain yourself. So just follow that link, drop in your email, and we'll send you an email to notify you of our next class.
Absolutely.
Okay, thanks so much. We'll see you later.
Have a great day.
Okay, bye-bye.